Good evening. My name is Alexander Jones, and I'm the bossless of the Epsilon Iota chapter of Omega Psi-Phi Fraternity Incorporated. We thank you for attending our Omega Uplift Series number 17, an in-depth conversation about diabetes. Last month, we spoke about colon cancer and prostate cancer and why prevention is better than cure. This month, we would like to speak to diabetes, which is the 7th leading cause in death in the United States. In 2019, 60% of African Americans have been diagnosed with this disease. I want to thank our Social Action Committee for the due diligence they demonstrated in putting together this program to again make sure our community is informed. Since the Omega Psi-Phi Fraternity Incorporated was founded on the campus of Howard University 110 years ago, we've been guided by our 4 cardinal principles of manhood, scholarship, perseverance, and uplift. Omega has played and continues to play a vital role in the social and economic growth of our country and enhancing the lives of African Americans. As a fraternity, we operate under a 12 nationally mandated program, which are centralized around issues in our communities. Epsilon Iota chapter has been a staple by providing service to the greater New Haven community for over 32 years. Before we get started, I would like to share a few reminders. All participants will be muted during this presentation, but we do encourage your active participation by utilizing the chat feature. All questions will be acknowledged at the appropriate time. I would like to take the time and thank our esteemed panelists for agreeing to participate and give their expertise on this very important topic. Our series moderator is a brother who plays many key roles in Omega, not only on the chapter level, but also on the district and international levels. He was also recognized as our current First District Omega Man of the Year. He is no stranger to the greater New Haven community, where he serves as head coach to the Wilbercross boys varsity basketball team. He is also a co-founder of Storytellers New Haven. He serves as a moderator, a mentor to the youth, a leader amongst many men, and an advocate for all. We hope you enjoy our program. I will now turn it over to our Social Action Chairman and our Omega Uplift Series moderator, Brother Kevin Walton.
Good evening, everyone. And Brother Bossless, thank you for the introduction. And protocol having been established, I want to thank our Social Action Chair, Brother Giggy Martindale, for entrusting me with this tremendous opportunity this evening. And tonight, and I can't believe you said, Brother Bossless, that it's number 17. It feels like we've been doing it, like we might be on number 50, but 17 it is. I think we've been doing a tremendous service to the community since COVID and beyond, and bringing great information to our community. And so I appreciate the opportunity to continue to do that tonight. And welcome everyone to the Omega Uplift Series. And tonight we have an in-depth conversation on diabetes with our one and only panelist, Joy Cornwaith, who is a registered dietitian, a certified diabetes care and education specialist, and she is located in Houston, Texas. So I just want to reiterate what's going to happen tonight. Ms. Cornwaith is going to give her presentation, and then if you have any conversation, any questions or comments, you put them in the chat, and we'll get to those, and we'll respectfully allow Ms. Cornwaith to do her presentation and finish and do any questions and answers after that. So without further ado, I turn it over to Miss Joy Cornwaith.
Hi, everyone. Thank you so much, Kevin and Alexander and Giggy, for inviting me to session today. It's one of my passions, as Kevin said, that I am a dietitian as well as a certified diabetes care and education specialist. And before we jump in, I just want to say, dump your questions into the chat so that, if Kevin needs to jump in and pause me in the moment, if you have a question in the moment, I really like interaction with people when I have conversations. And I just want to leave you today with the ability and the resources and knowledge to take the best care of yourself, your partner, your family, your community as possible. My background is I am a Caribbean girl. So half of my family is from Curacao, right next to Aruba, and half of my family is from Barbados. And when we moved to this country, my parents were diagnosed with diabetes. There was sort of like an issue and a challenge around care that was culturally sensitive, as well as respectful. And that theme continues today in a lot of healthcare. But I decided I would make a difference. I would learn about biochemistry, learn about diabetes care, and I would change the world for my family. And so it's gone from my family to my patients to my community. And I'm also on a global initiative that helps to create frameworks that provide respectful, personalized care to people all around the world through our global initiative called Cities Changing Diabetes. So without further ado, let me share my screen with you all. And what I'll do at the end of the session is I will help to put some of the thoughts that you bring up during your conversation and your questions towards the end of the slide deck, and then I'll share it with everyone through our leads here, if that's okay, so that everyone has access. I would only ask that you kind of keep it to yourself. So it's my own deck creation. And so if you could just keep it within your quarters and not like present it to the world once you have access to it. So let's start. All right, perfect. All right, so what is diabetes? I think the key is to understand what's happening in your body. So I'm going to go over a little bit of one of my most passionate topics, which is biochemistry. Don't freak out, okay? Don't be too worried. I won't make it too crazy and technical, but it's one of my favorite classes because I think when it came together to explain what was going on in the human body, in my body, in the body of my family, in the body of my patients, it helps to frame how you take care of yourself, and it gives you power to make the decisions around medication and behaviors in a way that's knowledge-based and not dictated to you by a physician that you meet and see maybe for 10 or 15 minutes a year. So what is diabetes? Diabetes is essentially when your body is unable to manage and process glucose. So all of us, we eat food, and then our food digests, it gets absorbed into the intestines, and then insulin, which is a hormone, it's a messenger hormone. So insulin is needed to guide the glucose from your intestines into your bloodstream. So it's kind of like insulin comes along, finds the glucose molecule, gives a secret handshake to the cell, and that's what pulls glucose into a cell where it's actually supposed to be. Now, what happens when you develop diabetes, or when you're developing diabetes, like in pre-diabetes situations, the insulin levels are decreased. So there's family history that's involved with how much insulin we actually produce. It's all decided by genetics for us. But if your body is not producing enough insulin, there's not enough insulin to move the glucose out of the intestines and the bloodstream into a cell where you can actually go and use it. So imagine that you're driving on a highway. You don't belong parked on the highway. So glucose doesn't belong parked in your bloodstream. It needs to exit out of the bloodstream and into a cell where we can actually use it. The issue comes when there's too much glucose in the bloodstream, because then it starts to wreak havoc on the system. Our blood vessels start to get damaged. The tiniest blood vessels, which are like our fingers, our toes, our eyes, start to become blocked by the large glucose molecule. You can't get water or oxygen to those places. And then you start to have vision changes or changes in the ability to touch and feel things. So essentially what we're needing to do when we're self-caring is lower the glucose levels so that your body can use the bloodstream to send nutrients and hormones to different body systems and keep the glucose levels down, okay? So genetics and environment. So one, I mentioned that we are all the product of our genes, right? Our genetics. So if we have a family history of diabetes, when they ask you if your parents live with diabetes. If your parents live with diabetes, essentially what that tells us is that you got the same or similar genetic composition for your beta cells. So insulin is created in the beta cells that live in the pancreas. So once your genes tell your body how much insulin you're going to produce for the entirety of your lifetime, that's how much insulin you're going to produce for the entirety of your lifetime. Usually diabetes care is going to try to preserve as much of that insulin, spread it out over your lifetime so that it takes longer to develop glucose issues. Most of us will develop some sort of glucose intolerance when we're 70, 80, 90 years old because the cells have aged. However, if through lifestyle and behavior, you're using up a lot of insulin today, you're not going to be able to have all of the insulin in your system over time. So imagine like your parents are leaving you money. Some people's parents will leave them millions of dollars. And so they can ration out those funds over their lifetime because they have excess amounts. However, some people won't get any. So if that's the case in terms of like diabetes, if you have a family history of diabetes, it's like having a very, very small inheritance and needing to ration that over your entire lifetime. So these are the different types of diabetes. So we have prediabetes, which I talked to the gentleman about this a couple of days ago, is a misnomer. If somebody tells you that you're living with prediabetes, treat yourself as if you have diabetes. Prediabetes is 5.4 to 6.4, okay? So if you take your hemoglobin A1C, which is a measure of your blood glucose over 3 months, the amount of sugar that's stuck to your red blood cells, if it's 5.4% to 6.4%, you're considered pre-diabetes. 6.5% is when they diagnose you with diabetes. However, if somebody ever tells you, if you don't leave today with any information other than this, if they tell you that you live with pre-diabetes, act as if you live with diabetes so that you can stay in that pre-diabetic phase for the rest of your life, okay? If you don't start treating pre-diabetes today, it will progress through diabetes that's harder to manage, diabetes that's poorly controlled, okay? Type 1 diabetes occurs when the body produces little or no insulin whatsoever. So usually people who live with type 1 diabetes no longer produce insulin. They must take insulin for the rest of their life. Type 2 diabetes is going to be on a spectrum. So some people develop type 2 diabetes where they produce enough insulin, but they produce a little bit of insulin, enough insulin to self-manage without taking medication, but it can slowly progress towards very little insulin and needing, or very little natural insulin and needing insulin medication. LADA is latent autoimmune diabetes of adulthood. It's essentially if someone hasn't been diagnosed with type 1 as a child, if they're adult and they're diagnosed with type 1 diabetes, they call it LADA, okay? Gestational diabetes can occur when someone is pregnant. So it's essentially caused by an elevation of all hormones in the system, especially your pregnancy hormones. And the woman's body is unable to produce her own insulin, and it causes high glucose levels during pregnancy. After pregnancy, for about 75% of women, gestational diabetes disappears. However, it is a precursor to type 2 diabetes. So if a woman is diagnosed with gestational diabetes, if she doesn't do all the self-care things we're talking about today, it can progress to type 2 diabetes in 5 to 10 years, okay? So gestational diabetes is a heads up, just like prediabetes is. Please take care of yourself starting today for the rest of your life. And then, of course, there are other forms of diabetes like injury to the pancreas, or like a resection of the pancreas, or different things that medications that might cause diabetes. I'm going to pause here just so I can check in with my moderator to see if there are any questions, if anyone needs me to clarify anything. Oh, I can't hear.
Yeah, I'm on mute. So I don't necessarily see any in the chat, but I did have a question. And so you give 6 right here. It's 6. I don't know if it's 6 phases or 6 forms. So my question would be, what are the signs of the 6 forms of diabetes, especially the most common form in Black men and Black women, which I imagine are type 1 and type 2? Because you could talk a little bit about those 3.
Mm-hmm. So I'm going to stop sharing just so that we can all see each other again. The most common symptoms of diabetes are 1, excessive thirst. So diabetes mellitus means sweet urine, okay? So in case you have a trivia that you need to figure out, you'll be like, I know, I remember Joy told me. So the way they used to diagnose diabetes back in the day was to take a urine sample and then, like really way back in the day, Greek times, they would put it on the ground and see if ants came to it. So the body naturally doesn't like to waste energy. So it doesn't like to get rid of sugar and just waste it. It's like wasting food. So if you find glucose in your urine, it generally indicates some type of diabetes. All right. So when people are really, really thirsty, it's because if you look at the biochemistry behind diabetes, your body is trying to get rid of the extra sugar the only way it knows how. If there's too much in the bloodstream, your heart can't pump regularly because the sugar becomes sticky. Your brain doesn't get enough oxygen because the glucose levels are blocking. So if you're very, very thirsty, excessively thirsty, and you continue to drink and you can't stop it, that's the one sign, because your body's trying to put all that extra glucose in your urine. That's sign number 1 that most everybody notices. For family members, if you notice that they get the itis after eating, so they eat a big meal and then they sit down and they feel real sleepy, okay, and they're falling asleep on you. That could also indicate elevated blood sugar levels, because remember, I said if there's too much glucose in the blood, other things can't move, including oxygen. If your brain can't get enough oxygen, it puts you to sleep so it doesn't get damaged. Does that make sense? So excessive urination, hypersomnolence, we call it, or very, very sleepy immediately following a meal. Blurry vision as well, because the blood vessels of the eyes will be blocked by the large glucose molecules. So if you find that you have floaters, or you're starting to see your vision come in and out of focus, usually, interestingly enough, 2 physician types diagnose diabetes most. For women, it's gynecologists, because women will get UTIs, or urinary tract infections, as well as yeast infections, because as you urinate too much, the extra sugar will feed the bacteria. So usually a gynecologist will diagnose it for a woman, and an optometrist will diagnose it for both, because they'll see into your eyes once they dilate that the vessels are damaged. Okay. So those are probably the most apparent of the symptoms. Oh, Kevin, mute.
So I'm sorry. So I guess, and thank you for clarifying that. So I guess my follow-up question would be, and we all joke about it, right? After we eat a meal, especially around Thanksgiving or the holidays, and we always talk about we have the itis. So is the itis, is it real or not? Because you touched upon it a little bit. And
yeah, it's for everybody. It's a thing that we just call it, right? We call it something because we've seen it, and you can have that without living with diabetes. Okay, just to clarify, you can have that because anybody who overeats can have high levels of sugar, right? But if you're experiencing that every time you eat, no matter what you eat, and on top of that, you have excessive thirst, your mouth is dry, your skin will become very, very dry. because your body will try to use the water from your skin to get rid of the extra sugar as well. And I know my maiden name is Ashby, and my friends, you know, if we didn't lotion that day, they would call us Ashy, like Joy Ashy. So if you always lotion and your skin is still dry and you feel sleepy every time you eat and you're excessively thirsty, you need to check yourself for diabetes. Okay. The other thing too is, before I get another question from you, let me share this again. So this is a place that you can go to take a quick 1-minute test. You can do it on your phone. If you go to the ADA Know Your Risk, it'll ask you a series of questions about diabetes that include your family history, for women, the history of gestational diabetes, symptoms, has anyone ever told you that you had an elevated blood sugar? And it will throw out some insights based on your input. And then it'll also give you some questions that you can ask your physician using the printout that comes out just for you. Okay, so everyone should, you know, everyone on the panel today, I would really like it if you could just go and take your 1-minute risk test. You don't have to give it any information besides the input. You don't have to tell it who you are. You could do it from like private mode if you don't want ADA to know that you did it, or, you know, where in the world you were when you did it. But it'll give you some really good insights and also questions to start the conversation when you get to your doctor's office.
Okay, well, great. Thank you.
You're welcome. Should I keep going?
Please proceed.
Okay, thank you. So step number 1, when you're managing your diabetes, hydrate, okay? Or if to prevent diabetes as well. Remember, I said insulin's very important to lowering your blood sugar. Naturally, water is as well. So if you're trying to prevent exposing your body to high amounts of glucose, you have to drink water, okay? Water will help to lower your blood glucose without you needing to use up your insulin stores, okay? Prevention also moves by developing healthy habits. So physical activity and fitness planning. I always tell my patients and my patients' like partners and family member is there are 2 things in the world that will lower your blood sugar without using any of your natural body's resources. So you can protect overuse of your pancreas, overuse of insulin by drinking water to get rid of extra sugar, but also by moving your muscles, okay? So muscles use glucose without insulin. The minute you start to move, your body's lowering your blood sugar. Okay. Smoking. Smoking is a big one. Just want people to stop smoking. Smoking will actually cause something called free radicals to move around in your bloodstream. So when you smoke, you create chemicals of the free radicals. Those chemicals, you know how your blood vessels on the inside are nice and smooth? Those chemicals will damage small spots in your blood vessels. And when they're damaged, it's kind of like, you know, your tile in your bathroom. When it's nice and smooth and the tile is unbroken, you can clean it really well. There's no mildew and mold building up inside of the tile. But if you took a little tiny hammer and just broke a couple of the tiles, anywhere that there's a crevice that's now damaged is a place for bacteria to grow, glucose to grow. Also, it's a place for cholesterol to adhere and then start to build up and damage your blood vessels. So you really want to protect your blood vessels as much as you possibly can. And then weight management. Weight management is a big one because weight can lower your body's ability to lower your blood glucose, okay? So when fat cells send messages to each other, they interfere and knock insulin off of its job. So if you're able to lose weight, you're able to improve your insulin use. The middle one here, everybody knows about, we'll go into in a little bit more detail, but nutrition, eating well, balancing convenience and sustainability, as well as cost. And then the last thing is glucose management. Talk to your doctors about glucose targets. If they say, oh, you have prediabetes, say, okay, what does that mean? Let's break it down. What numbers should I be looking for? When are we going to follow up on a test? We can take a preliminary test now, give me 3 months, let me manage my care, and let's do it again. You have to ask them to come back to reassess. You don't want to have prediabetes and then go to the doctor 3 years later, and now your diabetes is really, really poorly managed diabetes. You want to check in with them, okay? Consider glucose monitoring. Anybody who wants to talk to me offline about this, I think that if you do not know what your number is day to day, you will not be able to self-care. It's the reason that we have odometers in our car. If I didn't have an odometer in my car, I might drive my minivan a little bit faster because out of sight, out of mind. I don't know how fast I'm going. I'm just going, okay? Know your hemoglobin A1C. To backtrack a little bit, hemoglobin A1C tells you 3 months worth of information because it takes the oldest red blood cell, counts up the amount of sugar that's attached to it, and then we can back calculate what your blood sugar was for the past 3 months on average. And then even if you live with prediabetes, there are some prophylactic medications that can be taken at super low dose to hold you in the same range for 10 to 15 years, okay? All these things are sort of healthy human things, right? So moving, eating healthy, managing your weight, setting your targets with your doctors, asking for a referral to either a diabetes educator or a dietitian. There is a website, if you want to write it down, it's called eatright.org. /find an expert. That will allow you to find someone. You can also use your EAP, so your employee assistance program benefits. Generally, they have a diabetes management or pre-diabetes prevention on their plan. Most employers who also provide healthcare are really interested in it. So sometimes those programs will send you a glucose meter if you've been diagnosed with pre-diabetes, and they will give you a coach, like a life coach, because it costs more to your employer if you're unhealthy. So they're really interested in doing preventative measures. So, and then the third thing is to check with your insurance company, see who's in network that covers nutrition or diabetes, and meet with someone. Okay, so you can be proactive about that. Most insurance plans, as of like early 2000s, started covering some level of diabetes or nutrition care that's billable. Make sure that the person that you meet with is person-centered, so they get you, they understand you. One of the things that I'm always telling my patients about, and people when I go to we have something called Faith in Diabetes here in Houston. So about 80% of people attend some sort of religious house of faith. And so we created a toolkit that overlays the teachings of different religions on diabetes education. So one of our biggest partnerships has been with Fountain of Praise, which is a Christian house of worship, and a lot of the church communities center around this one church, and they have a health ministry. And so what we've talked to them about a lot of times in the community, whenever we have outreach on Sundays or Saturdays after services, is if you meet with a person who does not respect you, who disrespects you, and you're paying them or your insurance is paying them, fire them. Okay? If they do not treat you and respect you as a patient, don't continue to go to them. Find someone else. It's like you can have like quick what do you call those things? Like when you do like the fast dating, do a discovery, call the doctor, see if you could do a discovery visit with them. And it'll be like a 15 minutes where you can figure out, does my soul vibe with this human? And if it doesn't, and they don't understand you and they don't understand your culture and they don't respect you, run away. Because Black people have a really hard time in the healthcare system, period. But if you don't have a clinician advocate, you will have an even more difficult time, and it could cost you illness and life, okay? So no harm, no foul. Sometimes patients come to see me, they're like, you're not my cup of tea, and I refer them to someone else who might be, because I know my different colleagues, okay? Initiate treatment, that is shared decision-making. You should be able to communicate with your doctors, and then modify your treatment. Be responsive to outcome changes, be flexible, and think about how you're experiencing diabetes, and write some questions down that say, hey, doc, when I take my medicine, I feel this way. Is this right? Okay. And have those questions ready before you get there. So as we're talking about healthcare, one of the things that came up recently, and I talk to my patients about all the time, is an extension of this, right? So if you're diagnosed with diabetes, or you have the symptoms and this starts to happen, it's something that you really need to pay attention to, because it can impact your entire life and the life of your partner or your spouse. So sexual and reproductive health is something that can be impacted by diabetes or elevated blood sugar levels. So you can talk to your spouse about it. It's really important to be open about it. This can be defined as like a low libido, decreased desire to engage in sexual activity, or decreased ability to engage in sexual activity. Remember, I told you that when the glucose values are elevated, your blood pressure can't move. One of the things that stimulates arousal is a shifting of blood flow to our sexual organs. And if the blood flow is hindered by glucose levels, it can actually prevent you from becoming aroused. Okay, so it's really important, if that starts to happen and you're feeling this happen, talk to people. I think supporters is on here, but I think you have to know first. So the clinicians that you can have a discussion with and you can schedule with are your primary care physician. You have internal med that takes care of just adults. And then you have family practice physicians who take care of across the family spectrum. They're like really experienced in like family care. Reproductive endocrinologists are especially for men and women. So if you've been with your partner for a long time and you all are trying to have kids and there's become difficulty, or there's elevated glucose levels, or PCOS is present for the female, then you want to talk to a reproductive endocrinologist, because that will hinder ejaculation, and that can also decrease fertilization of the egg, okay? You can also talk to diabetes care and education specialists and registered dietitians or registered nurses. Diabetes care and education specialists can be either dietitians or nurses, or even clinical pharmacists, okay? And I'm going to take a pause because I feel like Kevin has a question for me.
Well, so what I wanted to say is this: if, again, for folks who, thank you for joining us, and if you have any questions, please put your questions or statement in the chat, and our vice bosses will walk us through that. But I did have another question, because a couple of things you kind of raised my curiosity. So, and I want to thank you for your self-advocacy. That whole point about kind of once a doctor, and we talked about this the other day, right? Pre-diabetes and what it is. And you talked about just now, if a doctor said you're pre-diabetes, advocate for yourself, right? So what does that mean? And what's the next steps? And we should always do that, all that. And we've heard that through all of our presentations over the last couple of years about self-advocacy. So thank you for raising that. My question becomes though, how many people so there are 26 people on this chat right now, right? And when you talk about having some symptoms or whatever, statistically speaking, how many of us are really going to go out and kind of get checked?
I want it to be 100%. So
We
I'm
all
a
want to,
clinician.
and I want to win Powerball tonight, right?
So, well, let's ask everyone. Just put in your little, you know how you could choose your reactions? Like, just choose your reaction. Is it a thumbs up? Is it a thumbs down? Are we not wanting to know? Because some people, you have to ask yourself kind of where you are on the spectrum. Are you one of those people who wants to know to take care of yourself? That's who I am, right? I want to know so that I can live and thrive the best I can. I remind people who are like, I don't really want to know. I just want to live life as is. I remind people that if you live life as is and you become unwell, you live a life in which you do not feel good. That is not your best life. You cannot do things. You cannot go on trips if you feel unwell all the time. You may take more time off of work, and that keeps you from having vacation time because you're all on these sick days. It trickles into your life when you're unwell. I would rather live a life of, 60 amazing years where I am traveling with my kids and meeting my grandkids than live a life of 80 years and 20 of that be unwell, where you can't walk, you can't see, you can't go to church, you can't fellowship with your team. There are a lot of things, one of the things that one of the pastors says at Fountain of Praise is 3 in 5 people in the US live with some type of diabetes and have not been diagnosed. Okay. Imagine that on your boards around 3 in 5 people become ill. What is going to happen to the giving? What is going to happen to the community that you support? If you become ill, what happens to your family members? Just take the risk test and then go get it checked out. And it may say nothing, but if it says something, you now are empowered with more knowledge to help yourself. So it's my wish that maybe if you guys take a poll after everybody comes on here, a secret poll, that that people will have thought about it and gone to get checked, and take a friend with you. So if you see someone here that say, hey, would you like to go with me? Let's go together.
So what I heard you say is you can't beat God's given no matter how hard you try. But the other thing I just want to point out, right, is so what do you say to the folks or the people on this call who have that historical distrust of medicine?
Mm-hmm. I would say there are more people of color in medicine than you think. It's hard to find some of us. I'm in Houston, so there are a lot of clinicians in the Texas Medical Center, period. But I am probably one of the few and more vocal of the Black dietitians in the diabetes space. So if you can find someone, sometimes patients from somewhere else in the US will contact me and say, hey, do you know someone? And then I'll contact someone for them in their area and then get them connected with that person. There's a place online as well called Beyond Type 2 and Beyond Type 1. The senior editor at Beyond Type 2 is one of my friends, Tiara, and she is from Baltimore. She is a huge diabetes advocate. She is a incredibly talented and smart young lady, and younger than me. And she has made her way in this diabetes space. She was incorrectly diagnosed with type 2 diabetes and later diagnosed with type 1. She can also find people. There's blogs on there and messages where you can message the team directly, and they will help you find someone in your space who, if you feel, research says that people who are cared for by clinicians who look like them do better. And that's not just for Black people, that's for everybody. That's for Asian people, it's for people of East Indian descent, Caribbean people, because you don't want to have to explain who you are at your core and what you do in your regular life to someone, to everyone all the time. If you meet with someone, they already know who you are, right? And then they can start from there to take care of you. So I would say find somebody or find a resource that can help you find somebody.
Great, thank you. And we do have one from the chat. Brother Craig Streeter talks about, he mentioned the fact that A1C is checked during your annual physical.
Yeah.
Right.
Now,
and so is that the place where you're getting that initial information?
You can. Not everyone goes to their annual physical.
Well, and that's exactly the point, right? And that's exactly the point that I was trying to make, right?
Yeah. So
Right.
please schedule. Okay. Now I'm gonna tell a little bit about my partner. So don't tell him if you ever meet him. But I sometimes schedule a visit for him because he's not gonna do it. He's like young and not unwell. So sometimes I'm like, hey, it's time for your annual. Why don't you take a look at this? Also, on your health insurance for either your job or like whoever's health insurance you're on, if you do a physical, sometimes they give you back money. Okay, so if you do a physical, there are some employee assistant programs, they won't tell you, the benefits office won't tell you, but you might get back $200 for just going to the physical each year. And women, if you're not going to go to the physical each year, if you're just going to go to a gyn visit, I work in a women's health clinic, and sometimes my doctor has to remind me that it's time for my physical. They will actually do an A1C while you're doing your wellness visit for the year. So you don't have to find another PCP, another primary care doctor.
So, and thank you for that, right? And thank you, Brother Streeter, for raising that. So can you just share with our audience what an A1C is?
Okay, so the A1C, to go back a little bit, it's this fancy protein that lives on a red blood cell. And that red blood cell protein really likes sugar. It's attracted to it. So in chemistry, you've got things that are like water, things that like sugar, so what they've done is they've isolated that protein. And we know that as the red blood cell floats around in your blood, if there's extra sugar, it attaches to the red blood cell. So imagine like a donut with sprinkles on it, right? So what they do is red blood cells live and die every 3 months. So they draw your blood and then they find the oldest red blood cell and they count what percentage of those proteins have sugar attached. And then you back calculate how much sugar it must have been exposed to make those numbers elevated. If you get your hemoglobin A1C done, you can actually go to the American Diabetes Association website or just Google hemoglobin A1C to blood sugar level, and it'll convert it to you. There's like a mathematical conversion, but if you have like a 6.7, you can type in 6.7 and it'll tell you what your average blood sugar is. And everybody's average blood sugar should be less than 110. Okay.
All right. Well, thank you. Thank you very much for that. And thank you, Brother Streeter. So listen, we're going to allow Ms. Conway to continue. I just want to encourage folks, if you have comments, questions, please put them in the chat. And that would be great. So Ms. Conway, please proceed.
Okay, so let's go. Let's keep going here. Nobody has questions about reproductive health, huh?
Yeah, it's gonna let that one go right by. Go right by. Everybody's good.
We'll wait to the end. We'll wait to the end. If you need to call me offline, call me
I
offline.
call you offline.
Yeah, call me offline. So these are the multitude of factors that can influence your glucose response. So even if you're doing really well with hydration, some of the things that can change your blood glucose, if you're checking your blood glucose levels, is temperature, so hot and cold, because we tend to lose water when it's hot during the summertime. That can make your blood glucose go up. Different medications can do it. So if you've ever had to be on steroid therapy, that can make your blood sugars go up. Also, how much activity you do. So if you slow down, COVID increased the rate of diabetes diagnosis. There were a couple of different reasons, but one of them was just people not moving. So if your muscles aren't moving anything to lower your blood sugar, your body has to do it all on its own. So if you become more inactive, if you switch jobs and your job becomes stay at home and you start counting your steps and you're only getting 1,000, that can increase your risk of diabetes. Not sleeping and stress is a big factor. Once we sleep, our hormones reset so that when we wake up, our body works properly. If you go all night without sleeping, the next day, your cortisol levels are increased, and that will increase your hunger and your glucose levels for the entire next day. You'll feel more hungry because you haven't slept. So if you're having sleep dysfunction as well, you want to make sure you let your doctor know, because that can contribute to diabetes as well. Now, everybody's body is unique, but those are the things that will definitely impact anybody's hormonal levels. Okay, so build your team. I'll come back to this. Your clinical team. You have your primary care doctor. If your primary care doctor isn't pushing and you have insurance and coverage, you can ask that primary care. Not every primary care doctor is going to be very well trained in diabetes management, because they could just be taking care of people across their lifetime. So if the doctor's like, well, I don't really want to manage your diabetes, ask for a specialist referral to an endocrine doctor. That endocrine doctor is specifically trained to take care of your diabetes. It's okay to get a second doctor. If you have a PPO, you can refer yourself. You can just call them. If you have an HMO, you do need your primary care to refer you to the endocrinologist so that they can cover it. Talk to your partner or your friends, maybe somebody that almost all of us know somebody and love somebody who lives with diabetes. That's how prevalent diabetes is. And then find your supporters to assist you. Okay. These are some of my recommended resources. So we started, as you guys did over COVID times, we started an outreach. We would just get together, me and my friends who are all diabetes specialists, and talk about diabetes. They're hour long, so just kind of like pick where you want and which one you want, but we covered everything. Insurance, vision health, medication, free medication resources, all of those kinds of things. ADCES is the Association of Diabetes Care and Education Specialists. They also provide patient-facing information as well as questions that you can check off to take to your doctor. And then, of course, the American Diabetes Association. So let's switch over from like all the complications and stuff and talk about food, okay? I think one of my professors in class actually was like, did this girl come into nutrition just to eat food? Yes, the answer is yes. My mom is Afro-Latina, so we grew up eating arroz con gandules, and which is rice and peas, and plátanos maduros, and those are like sweet plantain. We come from like a West African background, so we eat something called curry and something similar to like jollof rice, and so my parents' food was amazing. And then my dad's side is West Indian. So we eat curry, naan, roti, potatoes, all of those kinds of things. So yes, I did feel like we needed to figure out how we can eat so that we can still have parties, and what Barbados people call jump ups, which is you just everybody brings like food. It's like a potluck. Okay. So happily, I took this is one of the reasons that I really, really have a soft spot for biochemistry. And after this, you guys will too, okay? So it's because when I took biochemistry, I learned how the foods go together, what was in them, why we have to choose the foods that we have to choose. And the world came out a much more colorful place. And I was like, thank you, biochemistry. We can all still eat, and we can all have cultural appreciation all over. And every culture has the same chemistry within their foods. Okay, so anybody from anywhere around the world can eat in the same pattern. So meal patterning is the case. It's not necessarily taking away foods that you don't, that you always loved, and replacing it with things that my dad used to call rabbit food. Okay, so half of your plate should come from veggies. Remember back in the beginning where I said water is really important. Water cleanses everything. Okay, I mean, we learn it in church, we learn it in healthcare, wash your hands. We learn it in school, wash your hands. Water is a cleanser. Your vegetables contain water. The reason that we go so far astray with our health is that we don't consume enough vegetables. When you fill your plate with vegetables first, those are your cleansers. They're going to give you water. They're going to give you fiber to clean out your intestines and protect you against bacteria or like goodness, chronic diseases like diverticulitis. It helps to clean your system. Okay, so veggies are first. I don't care where you get your veggies. I don't care if you don't like them, or which ones you don't like, rather. I don't care which ones you don't like. What I want you to do is find the ones that you love and put them on your plate. For me, it's like, I like steamed cabbage. I like broccoli. I like cauliflower. I like salads, but they have to be crunchy cabbage salads, and they can't be kale. I dislike eggplant very much, but I always have something on my plate that's a vegetable. Does that make sense? You could cook it, you could steam it, you can have, I lived in Georgia for a while, and they taught me all about okra and tomatoes, which are delicious. And my Mexican colleagues taught me to eat jicama, which is like a crunchy, it's almost like a celery. That's Mexican. You can put anything on your plate that you want to. Here, I'm having like curry with cabbage. And then I'm also having here for brunch, like some leftover broccoli and tomatoes. Over here, we have, the kids had hot dogs, but they had vegetables on the side. So always start your plate off with veggies. Second place on here is carbohydrates. So your carbohydrate foods are colored blue for blood sugars. Your carbohydrate foods are an umbrella term for everything that gives you sugar. So your carbs, your veggies have very low sugar, lots of fiber, lots of water. They're not raising your blood sugar. It doesn't matter how much you eat. If you eat 3 plates of broccoli, you're just going to go to the restroom, and that'll lower your blood sugar. Your carb foods, the blue foods here, are going to be bread, cereals, grains, rice. Your fruit give you fructose. Your milk gives you lactose. All of those are just different types of sugars. Those are the foods that you eat a small amount to give you energy. So instead of 3 slices of bread, you have a slice of bread and some strawberries. But you can fill your plate visually with just a quarter of it coming from these foods. Then your protein foods are going to be the things that help to slow the sugar down. So carbs turn to sugar really quickly, but proteins take longer to process. So you're going to find your vegetable, look at your plate and say, where are my vegetables? I need more. You're going to find your carbohydrates, put a small amount on the plate, and then you're going to find your protein and have that. Okay. Protein can be eggs. Protein can be tofu if you're vegetarian. Protein can be fish if you only eat fish, if you're pescatarian. The protein serving should be at the palm of your hand. Okay, so just this part of your hand here. Okay, whoop, like this. Not the fingers, not the arms, not the shoulders, just that small bit. Okay. Humans don't need as much protein as we think we need. And if you are a person that has very large hands, like basketball hands, it's going to be like the triangle. Take off your thumb. Okay, that'll be your portion of protein. Don't come for me, Kevin.
Just checking it out.
Okay. So everyday meals should be able to be reimagined. You pick your protein, you add lots of vegetables, and then you enjoy your food. Okay. The bonus of that is that your veggies, they hold in things that help to control your blood pressure as well. So they have potassium, magnesium. They did one of the largest scale research studies called the DASH diet. So dietary approaches to stopping hypertension. It was one of the few like medical studies that really focused on minorities, including Black people. And so they looked at the addition of vegetables or the increase of a plant-based diet, and that was significant in lowering blood pressure. If you think about it sort of from a biology standpoint for the plants have to be really good about holding fluid and letting go of fluid. That's what keeps their leaves tight and their stems and their stalks tight. So they have the appropriate amount of all the things that hold fluid where they're supposed to. So when we eat them, we assume those properties, okay, like potassium, magnesium, calcium, that helps to regulate blood pressure. So if anyone's concerned with blood pressure, add veggies, not with a ton of salt in it, just a sprinkle, but add veggies to your diet and you'll see your blood pressure drop, okay? Make your plan and share it with your family. Everybody in the family eats the same way. We all pattern our meals the same way. We hydrate with water. We have like a pitcher in the refrigerator that you just push the button to get your water so it's cold, or you can lift it and pour it, but it makes it easier for the kids to go, whoops, in and out the fridge to get their water. Add veggies to the plate. When you go out to eat dinner, go ahead and order a side of broccoli or a large salad to share. Move your body around eating, pre-eat. If you're going to go out to eat with friends, like eat before you go out to eat so that you're not starving. You know what I mean? Like sometimes people will wait on Thanksgiving until Thanksgiving dinner at 3 and they wouldn't have eaten anything and then they just start eating everything because they're so hungry. Pre-eat. Choose your carbs strategically. Like, what do I want today that I really want? Bring your medications if you have medications for diabetes. Remember them, and then entrust someone with your emergency plan. So if you take medication, but something might happen, or you have a low blood sugar, or you've had problems, find one person, not everybody in the house, because everybody doesn't need to know your business, but find one person that is willing to help you or find your medicine for you. The next thing about, this one's a big one, is alcohol. Okay, alcohol can reduce the function of your medication or stop it altogether. The other thing that it can do that people don't notice is that it can intensify your medication because your liver clears poison from your body. Alcohol has the ability to become toxic. So once your body finds alcohol, it sends all tasks of the liver to clearing that alcohol so that your body doesn't become toxic. And what happens is the liver also clears medications. So if you're on things like Januvia or metformin or Forxiga, some of these diabetes medications, it can stay in your system longer because you took alcohol. So then the next time you take that medication, it can be a double dose. All right. So if you're gonna drink alcohol, tell your doctor, hey, I have a dinner event, a work event. People are gonna be drinking alcohol. I wanna have 2 glasses of wine. Should I delay my medication until after I get home? Should I skip it? Should I take it? What should I do? okay? Please talk to your doctor about medications. It's more impactful, especially when you have blood sugar lowering and raising medications than we even think, okay? Hydrate. Between your alcoholic beverages, drink a glass of water, please. It helps to delay, or it helps to reduce hangovers, because hangovers come when you're super dehydrated. So drink a drink, follow it with a large glass of water, or sparkling water with some lime in it if you want to still feel like you're cheering everybody, okay? But an alcoholic beverage should always be followed by a water, a hydrating beverage, followed by an alcoholic beverage, followed by water, okay? The serving size of alcohol for women is 1 8-ounce glass, 12 ounces of beer, and 2 ounces of hard liquor. For men, they get 2 of those things. So a little tiny bit more. If you are a small woman, then of course you have to reduce. If you are a small male, then you reduce as well. But the serving size is usually 1 wine, a couple of beers, or you can get 2 light beers. Your alcoholic beverages that also have sugar in them can raise your blood sugar and then drop them really quickly. So the last thing I'm going to say about alcohol, that's going to sound like I'm preaching again, but if you take in alcohol, it can lower your blood sugar. The liver is our backup for raising our blood sugar if we're in danger. So the liver is like your neighbor that looks over the backyard and comes over and helps you if it's necessary. Your liver stores extra glucose. I told you I love biochemistry, so here's more trivia for you. So your body does not only intake glucose. So if you eat food, you get glucose from food, right? But your liver is magic. It will store glucose for you, and it will make sugar in case you were starving through a process called gluconeogenesis. So it's like the new creation of glucose inside of your body. Isn't that cool? So your body, if you don't eat for days, you can actually just drink water and your liver just keeps shrinking. That's why humans don't starve right away, because the liver just keeps shrinking because it's using itself to make extra sugar for you. So say your blood sugar is heading low, your liver is going to pop up and say, "Ooh, I need to save him." And it's going to give you sugar, right? That's how your body regulates your sugar levels. But if you are drinking alcohol and your body is lowering your blood sugar, your liver is busy. It's trying to get rid of alcohol, so it will not catch you and give you sugar so you could pass out. Water, wine, water, wine. Sound good? Kevin's like, Joy, you are rocking my world. I can't handle you and your chemistry.
It's not just me, Joy, but thank you for sharing that information.
Okay.
We should have had that before Sunday.
So, and check on your friends if they take medications specifically for diabetes.
Doc,
So-
when you say wine per se, there any particular wine that's more healthier for a diabetic?
Mm-hmm. So your wines that have lower sugar are usually red wines. They're a little bit more tart. They're not as sweet. And I'm talking like dark red wines. So rosés have the most amount of sugar, like your sweet wines. Dessert wines are going to have the most amount of sugar. They're actually from like super sweet grapes, and that's why they're called dessert wines. They pair with desserts because desserts are super sweet, and then the wine will taste more bitter when they're super sweet. White wines, unless they're dry, will also have a lot of sugar in them. So you're better off with red wines. If you have like an aversion to red wines, you can get like a mixed wine That's some of the blends of reds. They're not as tart and they have less tannins in them. So they have a better flavor profile if you don't like something that's really dry. But dry red wines are going to be better for diabetes. You can drink it slower and then alternate between water. Does that help, Mr. Vader?
Yeah, I think thank
Yes.
you for sharing that. And Vader, is that all right? Does that
Help?
does that help? What about for
Alcohol?
tequila? I'm just-
The agave is good, right?
Sort of. It depends on how much agave. So agave is a good substitute for sugar because you can do half of the amount of sugar or sugar syrup and get the same amount of sweeteners.
So I don't know if you answered this already, but another question was these medications like Ozempic and for A1Cs, are these good or?
Yeah, so they've done a lot of studies about Ozempic. Ozempic and that series of medication, what they do is help your body to release some insulin. So it tells your body to release some insulin. It slows down your GI tract, so it keeps you from overeating, and it can lead to weight loss. Now, here's the thing. Remember having the good conversation with your doctor, right? You need to be honest with yourself. I'm going to exercise, I'm going to drink water, I'm going to eat better, and I'm going to take Ozempic. Together, that can develop a really good habit of always doing these good things, and it can lower your weight really quickly and improve your diabetes. If you depend solely on the medication to take care of you, when you come off of it, you're going to gain the weight again because you haven't done any of the behaviors to keep the weight off. So I always tell my patients, in concert with self-care and all the healthy human things, those medications are really powerful to improving your health. But alone, they can do it. But if 100% of the weight loss is dependent on the meds, when you take away the meds, you're going to gain the weight back. If you are on it and you're experiencing severe GI discomfort, like pain just underneath your rib cage in the center, let the doctor know. It can be linked to causing pancreatitis. So if it's asking your pancreas to do stuff, it could cause your pancreas to become inflamed. If you start feeling that really, really deep pain or sharp pains right under there, let your doctor know so that they can stop the medication, because you might be one of the people who have an adverse effect of Ozempic. Okay, but always do the healthy things, add the weight loss medication, and then it can help you and you can wean off of that medication. No medication is without side effects. Okay.
Thank you.
So
somebody said that they asked about my thoughts of lack of available diabetes medications. So Ozempic got an indication for weight loss, but they also have something that recently came out that's called Wegovy. Also, let me think, Iota. So there's more drugs in that treatment category now. So if you cannot find Ozempic, ask your doctor to switch you to a different brand name, just because Ozempic has tons of commercials. And that's why people see them, because they work in much the same way. The other thing too is if you live in a place where most of the pharmacy is centered around like CVS or Walgreens, try a local grocery store or Target, because you can have them change the prescription over, or you can do like an Express Scripts and have them send you 90 days so that you have more lead time before you need your medication. It's really unfortunate, but the marketing around it is really good. So a lot of times I just try to find sort of like a grocery store that doesn't normally get a lot of traffic, and then send the prescription there, and then my patient gets it there. Okay, kind of like an out of the way location. Bourbon isn't sweet to taste, but it does have sugar. So somebody put in the chat, bourbon isn't sweet at all. It does have higher sugar levels. So you do want to have 2 ounces or less.
Wow.
Yeah.
Okay.
You can still have it.
Yeah. So thank you. So that question came from Sade Heard, who is a friend of the show, right? And so thank you for that question, Sade. I think I want to go back a little bit though. When you talk about, are you talking about alternative medicines when you say if it's not CVS or Walgreens or Rite Aid? Because we do in surrounding town, like even in New Haven, we have like Into the Woods, who has a lot of different type of medicines, and then we also have another one in Hammond. So there's several stores around that folks can get to. So is there something we should be looking for different in those stores?
No, not a different medication per se, just a different location that has less traffic.
Oh, okay.
Or if there's absolutely no way to find it in your town, ask the pharmacist if you can either do an online order or ask your doctor if they can swap the medication brand name. So what I was saying was that like Ozempic acts like Iota, acts like Wegovy, I think it's called, is the new one. So if you can't find Ozempic, you can also swap to Wegovy if your insurance covers it, because it's the same type of medication. It works the same way.
Okay. We have another chat, and I'm going to turn it. And thank you for your question, and thank you, Joy, for your great information. So I'm going to turn it over to Brother Bossless to hit the next question in the chat.
Okay.
We have 2 questions.
Yes, thank you. Shelly Ann Herdia asked what about smoking cigars? I've heard that can contribute to inconsistent blood sugar management.
Yeah, so anytime you smoke, you're messing with vascular function, right? So your blood vessels will be damaged. So I talked to you a little bit about heart disease and damage in the beginning. So what happens is the smoke actually creates like bad particles or bad chemicals that can damage the cell walls. And if the cell walls are damaged, cholesterol can attach to it. And cholesterol keeps building and building until it causes blockage. And at the same time, you're actually increasing glucose levels. And if more glucose is flowing, it can cause damage to the heart because the heart has to pump harder. Imagine like a hose that's being blocked by something on the inside. Things can't flow well. And now imagine that hose also has sugar in it. So things can't flow well. And the blood vessels are damaged by smoking, deterioration of the cell walls, and increase of cholesterol. Smoking is one of those things that immediately stopping or weaning yourself off of it can immediately see healthy change in your blood pressure, in your glucose control, in your vasculature. Smoking is something that truly you should avoid at all costs. And they've even linked secondhand smoke to the same, because you're essentially taking in the chemicals and they're becoming part of your body. So if you can't quit, at least reduce, even just a reduction of smoking, like maybe 1 cigar just with your friends once a month is better than a cigar at home all the time.
So is that just cigars, or is there any other?
Cigarettes, anything.
Okay.
Also, what do you call those things? The nicotine containing, what do you call those things? I don't know why I'm blanking on the names.
The vapes?
The vapes, yeah. So even those.
What about cannabis?
So cannabis in excess, they've linked it as well, especially because it has like lung implications. There are different ways to get the same, depending on which state you are and if it's legal. There are different ways that you can get the same active ingredient as marijuana without inhaling it, without inhaling smoke from it.
Great, thank you. And hookah?
Hookah, same. So hookah has the same, it's something burning.
Jeez.
So minimize those and keep them to like, you know, leisure and not regular events if you can't quit altogether.
Absolutely. So let me say this. So we're approaching the end of, we have about 10 minutes left. So Ms.
Mhm.
Cornway, if you can begin to wrap up.
There's
and
only,
share your last,
yeah, there's
last
only
thoughts
a
with us.
couple.
Yeah.
And I think we've covered most of them. So I'll just share the last couple of slides here.
Mhm.
So I just want people to think of simple solutions, okay, for movement, simple solutions for making dietary change, and small solutions for changing activities that could contribute to deterioration of your vessels and your skin and your intestines. I would say I really like to sit with people and say to them, what's your motivation? And everyone needs to find their motivation. What's your motivation for better health? And I've had a gentleman that sat with me before. He really didn't have any motivation to eat better or go to sleep on time or take his medication. So it took us a couple of sessions. He's like, I'm kind of good with everything. But I said, what do you want in the next year? Like, what is an activity, an event that you really want to participate in, that if you were able to walk more or run more or sleep more, you can experience it to the fullest? And he said he wanted to go to baseball in Chicago with his son and his grandson. He wanted to experience 3 generations of men who grew up in Chicago, like experiencing like one of the greatest pastimes in his childhood. So we set forth a path to make it happen. He wanted to fit on an airplane, walk up the steps in the baseball stadium, have a hot dog, and not feel horrible, like in doing all of that. And so in that space, we were able to lower blood sugar. He checked his blood sugars to lower his blood sugar. He checked his blood sugar to minimize his medications. And lo and behold, he lost some weight. Just like that, he was on the plane with his son and his grandson and sent me a picture. You have to find what motivates you. I can't motivate people. The clinicians, the doctors can't make you do it, but you can. You have to pick what's most important to you.
Absolutely. That's great. He was able to go eat a $20 glizzy. Good for him. That is wonderful.
The key, I think, was the grandson and the son situation. I think that was the key.
And I hear you. So we didn't have one in the chat, but we had a text. Someone asked, are you taking new clients?
I am not currently. So what happened the past year, so during COVID, just a tiny little piece of who I am, I have always wanted to give back to the community. That is my thing. So I have always, my parents always gave back. It was part of their kind of raising of me, was that once you learn and once you have knowledge, you pass it on to others. So how, in what space? And I think fraternities and sororities here in the States have that same mentality. I see there's a lot of outreach, there's a lot of giving. So what I've done for much of my life is during, I work my normal job, and then I give outreach through church or the community, like on the weekends. And it kind of bled all into my life and home space, which my husband's super supportive about, but he also likes me, I think. So in this past year, I decided to apply for master's in business administration with a focus in healthcare, because I want to change the system in which I work. So I think that we shouldn't always depend on people to give free services or help on the side or consult on the side. We need to start interiorly inside the healthcare system. So I want to be a clinician who changes policy and is able to advocate from the inside. I do research primarily in minority communities, minority pregnant women specifically, in order to change standards of care, in order to lobby Congress to cover medications and to take care of people. And so the reason, short reason as to why I don't currently take clients is I have a full-time position. I now have a team of 11 diabetes care and education specialists and researchers. And I am in I'm going into the end of my first year at Yale for my MBA with a healthcare focus. Plus I have 2 kids and a husband. So I'm not currently taking clients, but I can connect you with someone who will take care of you, who I trust.
Great.
So if
We
anybody needs to
appreciate
do that.
that. Yeah. So this is 7:25. So any last, I think you have one more slide. Any last thoughts?
No,
And
no.
we good?
I just want to say I'm very happy to hear that you're being an agent of change, going back to get your MBA, because I'm a part of the NAACP, and a few years ago we did a study of all the hospitals here in Connecticut, and the representation of the minorities is very, 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 very. I don't know if I said. Happy to hear that you're doing, because we need a whole hell of a lot more.
Yeah, we definitely do. And I think one of the things is, like, if you're a clinician and you're making those decisions at the top that are supportive of people. So having lived with my parents who live with diabetes and having to find them shaking or sweating, taking their medication, and 8-year-old me was trying to like help my mom and dad. 14-year-old me was like appalled by the rudeness of the physician. I think I come at diabetes care from a different space, right? I've seen the heartache that it can cause on a patient level. And I've seen the benefits of having a good advocate. And I've trained my team to say, how do you make this worth it for the patient? Every patient, treat them as if they are your family member. And that is something that is deeply rooted in my team. And what I want to do is replicate that over and over and over and over again. And I have to have the force and the power of, power and influence in order to make that happen for every single person. It shouldn't just be us sitting together who, I think about the one-on-one situations that I have. I help my patients, I help my community, I help the church, but those are a few people. What about the people in California? What about the Black people in Chicago? What about the Black people in Louisiana? Everyone should have the same access to knowledge, resources, and advocacy as my patients have. And so that's really where I want to go with it.
Well, they could have started by joining the Zoom tonight. So the recording will be available for those folks too.
Yeah.
But with that, I want to say thank you very much. We've done 17 of these. And I think you were probably the first one, correct me if I'm wrong, that kind of carried the program by yourself. So I want to thank you for that.
You're welcome.
It was a lot of informative information. Brother Odom says, thank you so much. It's the most informative discussion he's heard about diabetes.
Okay.
And I think this will be another topic, given our social action chair's attention to Black men's health. I imagine there will be some follow-up to this. So again, I want to thank you, Joy, for joining us tonight. I want to thank all of our guests who joined in this evening. And with that, I want to turn it over to our social action chair, Brother Gigi Martindale.
All right, so just to wrap up before we go off offline, if you had a question that was too personal to speak or to type out, if you can send a message, you have my email, right, Gigi?
Yes.
So just send a one-on-one. Don't share too much information in email form because, you know, once it's written, it's always there. I will extend like a callback to anybody who was on the call, just to go over something for them or to give them a resource if they have some questions. Okay, there's not going to be like, that's my piece of giving back to the community that allowed me to share my passion with everybody else. Okay.
I think I heard her saying no group text.
Do not group text because it's your business. It's your personal, like.
Yeah, I'll mess with you. So thank you, Joy. Turn it over, brother Gigi.
Yeah, I think she heard that Vader answer all questions about everything, especially the cigars and the drinking. On behalf of the brothers of EII chapter of Omega Psi Phi, I want to thank Joy and I want to thank everyone for participating on this. Our next topic next month will be on March is Women's History Month, so our focus will be on women in the local Haiti community. So once again, thanks, Joy. I will be in touch with you. Follow up. Everyone have a good night.
All right, thank you, everyone.
Good night, everybody.
Thank you, Joy.
Thank you for having me.
If the
Thank you
brothers
very
can stay on for a few seconds on the Social Action Committee and any other brothers that want to stay on, that you're also welcome.